we know that men have seen a 40% reduction in testosterone levels over the last 2 decades. That's a significant reduction. When I'm looking at overall testosterone levels on a blood test, I like to see it up over 800. We're seeing a lot of people coming back 300, 400, right? And they're told that's normal, and that may be common. A lot of men are in that range. However, it's not normal. We really should certainly be up over 500, and roughly, 800 to 1,000 is really more of a sweet spot there. But so many men are dealing with low testosterone levels, and testosterone plays a huge role in both male and female physiology. And so a lot of times we think about it for libido or muscle growth, but actually the most important area that testosterone plays a role in is actually our mental health. Testosterone plays a huge role in your ability to feel good about yourself, to have goals, to drive for things, to be pursuing the things that, God has called you to pursue. And if your testosterone levels are low, oftentimes a lot of men and women will deal with mood disorders, depression, anxiety, low energy, complacency, poor sleep, and just overall metabolic dysfunction, and they just won't feel good, right? And they won't really be able to perform well. They won't be, their relationships will suffer, really everything in life suffers. And so it's really critical that we optimize testosterone levels so you can feel and function and be at your best. And clearly testosterone plays a critical role in your ability to build muscle tissue and to maintain that muscle tissue. And that's critical at any age, but particularly as people age, they develop something called sarcopenia, where they literally have muscle wasting, and also osteopenia, where their bone tissue starts to waste. We hear about women developing osteoporosis. Well, this is a testosterone deficiency, okay? Because that is a building anabolic hormone that's critical for bone tissue, and women need testosterone, right? They have lower levels, obviously, lower natural production levels than men, but they still need to produce it. And for men, we get sarcopenia as we age. A lot of men, especially as they get into middle age, are developing andropause, which is kind of a male form of menopause, where the men start to develop these bellies, right? Because they can't burn fat effectively. They lose muscle tissue. A lot of times they'll develop almost like breast tissue because they're not producing enough testosterone, and they have higher levels of estrogen. And when we have metabolic inflexibility for men, oftentimes we have a higher level of this hormone or this enzyme called aromatase, which converts testosterone into estrogen. And so a lot of men have lower testosterone and higher estrogen, which can result in male, breast formation, for example, a large belly. I always say you should be able to look down and see your toes. If you can't because your belly's in the way, that is an issue, right? That's a sign of insulin resistance and poor metabolic flexibility. So enhancing your testosterone levels is absolutely critical for, your brain health, your mental health, your physical health, muscle tissue, your libido, your ability to just feel great on a day-to-day basis. So here's 7 ways. Number 1, we got to improve the metabolic flexibility. At the root with low testosterone is going to be insulin resistance and the inability to go from burning sugar to burning fat. So we've got to improve our metabolic flexibility. I've done so many videos on this, but some of the key strategies are making sure that we're eating a lower carbohydrate diet, making sure that we're practicing some form of time-restricted feeding or intermittent fasting, making sure that we're exercising regularly. Now, a lot of the other things that I'm going to talk about as we go on really play a role in that metabolic flexibility, but that is the foundation, right? Getting the metabolic flexibility down is really the first step in optimizing our testosterone levels, whether you're a man or a woman.